There you go.
Hi. Hello, Mr. Hare. I'm Vanessa. I'll be your student nurse today. What we're going to do today is we're going to take care of your trach. We're going to get it all cleaned up. It'll help you, be able to breathe a little bit better and get some of those secretions out. So the first thing I'm going to do here is I'm going to take off the cap for the hydrogen peroxide and my normal saline, so I don't have to do that with one hand later. So now I'm going to put on my sterile gloves. Fix this hand. Alright. So then I'm going to grab the center of this, which is still sterile, and throw it away. Okay. I'm going to get my dressing, or not my dressing, my sterile field out. Down on the table. I'm going to take my other supplies from the kit and put them down on my sterile field. Okay. And now I'm going to use the kit for my liquids here. So with my non-dominant hand, I'm going to grab the normal saline and put it in the big section of my kit here, and then I'm going to take the hydrogen peroxide and pour it in these two small containers. So now that this is my clean hand and this is my sterile hand. So with my with my clean hand, I'm going to unscrew cannula. There we go. I'm going to take it out. Ask her to cough a little bit while she's doing that. And I'm going to set it in my hydrogen peroxide and let that bubble up for a little bit to get all the germs off. If I needed to take the dressing and the neck piece off, I would have a colleague or the patient hold their trach in place so it didn't shoot across the room. So with my sterile hand, I will go over to my sterile field and grab the brush, and with my clean hand, I will go ahead and re-grab the cannula here, and I'm going to take it and just push it through here, get it all cleaned out. And then I'm going to toss this in the trash. And then I'm going to place this in the normal saline to rinse it off. So then with my with my clean hand, I'll go ahead and take this dressing off my patient and throw it away. And if she needed the neck piece redone, or if it was getting too dirty, we could take that off as well. But as I said before, I would need a colleague or the patient to hold on to their trach so it didn't come out. So then while I'm rinsing my inner cannula, I can take with my sterile hand, take one of my swabs, put it in the normal saline, and use my clean hand to hold the trach or move the trach and go around the trach to clean the patient's skin so it doesn't get irritated. Then I would toss this and do the same thing one more time. Put it in the normal saline and go around. And toss this. Then with my sterile hand, I would reach in and grab my cannula and replace it in my patient and make sure it's locked. Now, since the sterile procedure is already done, I can use both hands. I would take my dressing and replace it under my patient. And like I said before, if she needed a new necktie, we could take this one off and put this one back around. Just make sure you have someone to hold it in place while you're doing so. All right, Ms. O'Hare, that's all we're gonna do today. If you have any problems, let me know, and I'll be here for you. Then I would take my gloves off, do my hand hygiene, and we're done.